Life shared that her daughter was coping with high-functioning depression. So joining us this morning to explain more about this diagnosis, we have Hartford Healthcare's Dr. Newfield with us, Chair of Psychiatry at St. Vincent's Medical Center. Doctor, first of all, thank you so much for your time today.
Not at all, Laura. Thanks.
Can you tell us what high-functioning depression is and how common it is?
Sure. It's not an official diagnosis. It falls under the category of mood disorders and major depressive disorder, but it isn't an official diagnosis, but more of a colloquialism.
So is it difficult for loved ones to spot if someone may be suffering with this?
It certainly can be. Unfortunately, people have embarrassment about coming forward because of the stigma of mental illness. And I think that's what makes today's conversation so vital, in that we're spreading the word that, especially during COVID, these issues have become a lot more commonplace and a lot of people are struggling with them. And as in the case of Miss Chris, you don't want to miss that. You want to be as open as possible because the consequences can be very, very serious.
Yeah, her case really captured the nation because she seemed to have it all, honestly. Someone who seemed to be at the top of her game, doing so well, such a beautiful person inside and out from what we can hear from her friends and family. So what are the signs that someone actually may be struggling? Because it may not be obvious.
Sure. Well, the first thing you want to think about, especially in somebody that it might not be so apparent, is do they have a history of depression or other struggles in the mental illness categories, anxiety or PTSD or something along those lines. And if they have they ever been having thoughts of hurting themselves or not living anymore in the past, or even attempts or hospitalizations? For those people, you want to be a lot more mindful that checking in and trying to form a trusting relationship is really important. Also realizing that these illnesses are episodic, and so there are periods when people will be doing better, especially with treatment. And then there'll be times where people either stop taking their medication or the stressors become overwhelming. And then you want to start looking at, are they eating well and consistently? Are they maintaining weight? Are they sleeping okay? Are they functioning as they normally do in terms of work or school or those things? And sort of be mindful about that. And when you start seeing those, approaching them as well to say, hey, I'm noticing maybe you're not doing as well. Is there anything we can talk about or do to help you?
Well, people may be watching this who may be wondering, hey, maybe I'm struggling myself. What can we all be doing to stay healthy mentally?
Well, I call it the 3 I's. I think that eat wise, exercise, and socialize. I think if you're doing those 3 main things, that can be helpful. Certainly sticking to your routine if you have a job or, if you have childcare responsibilities or other family responsibilities, those can be really helpful too in terms of, just getting from one day to the next. Sometimes that's the best we got on a given day when it's getting tougher.
And how can you step in to help someone? You always want to walk that line because you don't want to overstep and then have them shut you out. What is the best way that you found to have success getting someone help?
Yeah, I think, again, establishing that conversational, trusting relationship where hopefully if they're not doing as well as usual, they can approach you. If you're noticing things that hopefully you feel comfortable enough to gently try to mention it to them, if they're letting you in, trying to encourage them to maybe see their general practitioner, or if they're in mental health treatment, getting them to their therapist or psychiatrist. And again, not being afraid that if you think it's an emergency, that calling 911 sometimes can save somebody's life. And even if it's challenging in the moment for them and for you, it can be really life-saving.
Right, and at least you're doing something, preventing something that's irreversible. Doctor, thank you so much for your time today. Really important subject, especially amid this pandemic. We're seeing more and more cases. Thank you.
Thanks so much, Laura.
Okay, Alyssa, over to you.
Okay.